subscribe, write a comment regarding a video that you do need or like to see on my channel, and I'm gonna be more than happy to make it for you. In meantime, I'm continuing to create this video related or videos related to medical terminology, and this is our video, I believe it's number 6. We are talking about gastroenterology. This is my painting. On the last video we did talk about hemorrhoids, the procedure, the reasons, and a general cultural thing that you need to know when you work as a medical interpreter. So in this video we are going to talk about what? We're going to talk about acid reflux, stomach flu, and peptic or stomach ulcer. This is again 3 very common problems in the gastroenterology system, and if you work as a medical interpreter, it's gonna happen to you that you have to interpret in this encounter. And if you know the terminology as I'm giving it to you right now, that would make it really, really easy for you. My plan is to finish the medical interpreter terminology, and then I'm going to give you medical abbreviations as Vrapche requested. I'm going to keep creating these videos for medical terminology abbreviations, but before we go there, I want to give you a general terminology, and then I'm going to switch to the note-taking and how to note-take in a medical encounter. Okay, let's start with it. We're starting with acid reflux. This is something very common. A lot of people suffer acid reflux, and from time to time it could happen to everyone. So, in the stomach area, there is this part called lower esophagus sphincter. I will try to show you on my painting more or less where is the lower esophagus sphincter located in the body. So this is our throat or esophagus, and the sphincter is right in the middle, very close to our diaphragm. So the sphincter is like a ring or something that is squeezing and that is helping the stomach to close. The sphincter in our stomach areas and stomach muscles work together. So when the food moves through the body and goes down, the sphincter opens and allows it to get into the stomach, and then naturally the sphincter should close, right? But sometimes if this lower esophagus sphincter doesn't close, this creates the stomach acid to go up to esophagus, to the throat, and to our mouth. And this is called acid reflux, right? So there is few different types of acid reflux, and one of these is called hiatal hernia. This is when the sphincter and upper part of the stomachs move above the diaphragm, which means they don't move as they should, and doesn't keep the stomach acid inside the stomach. So which means the sphincter doesn't close, the diaphragm muscle that is supposed to help the food move down and all this doesn't work as quiet in synchron, and the sphincter remain open for longer time, and the stomach acids are coming up. Symptoms of the stomach acid reflux. This is burn in the chest and discomfort, bloating, blood in the stool, vomiting, burning. Dysphagia is called the feeling that we have a food that is stuck on our throat, hiccups that cannot stop, nausea, lost weight, wheezing, dry cough, and sore throat. That could be all reasons. If we have acid reflux, that could be a symptoms. Okay, there 1, 2, 3, 4, 5. Let me see how many tests I have. I have 5 type of tests that the doctors do if somebody suffer acid reflux. The first one is called Barium Swallow. This is a test also that they do it for ulcer, the peptic ulcer, the number 3. I'm just gonna slightly talk about it. You're gonna have patients with that when you work in gastroenterology interpreter. So the barium swallow is when the doctor requires the patient to swallow special substances, which is called barium, and then they do the x-ray and they follow the movement of the barium, and they're able to see if the sphincter is closing well enough or no, or if there is any other kind of problems. Okay, esophageal manometry is to check the esophagus movement. The esophagus is this tube that starts from here and go down to the stomach, the tube through which the squeeze and make the food go down. Okay, we were talking about gastroenterological tests related to acid reflux, and we were to number 3 test called pH monitoring. This is to check for the acid in the esophagus, where the doctor insert a small device inside the throat into the esophagus and leave it there for a few days in order to measure how much acid fluids are going back. Then we have the most classical one, which you would probably do, called endoscopy, where the doctor insert a long tube through the throat. And you guys know during the endoscopy, there is also possible to be taken biopsy. Biopsy is taking a small part of tissue from the body and is examined in the lab. Okay, what is the stomach flu? We're going to talk about number 2 thing today, a stomach flu. The stomach flu is inflammation or infection of the intestinal or stomach, and it could be due to virus, parasites, and bacteria. This is the number 2 most common problem in America. Imagine. The reason could be the symptoms: diarrhea, cramps, nausea, vomiting, a fever, and a headache. Especially if it's a continuous stomach flu, it could be very unpleasant. And there are 2 main viruses or bacteria. One is called noroviruses, and then the other one is called rotavirus. They are very easily transferable through food, through things that we touch and so on, especially in the families. The peptic ulcer is another thing that is very common, which is the sore in the stomach or in the duodenum or on the bottom side of the esophagus. This can create problems or discomfort between foods and between in the night. What is this exactly? The ulcer is when the stomach acid damage the stomach muscle wall, or duodenum. Duodenum, there was a movie we were talking about where is the duodenum, but this is somewhere here. So if we have the sphincter, let me show you. So if this is our esophagus, this is where we have the sphincter, which is the part that should close, and duodenum is the immediate part that starts right above it, and it's basically the lower part of esophagus. It's the tube and could be damaged if there's a lot of acid going on there. There is the ulcer can be also caused by bacteria. It's called Helicobacter pylori. Even we do know that this is a good bacteria. If it's too much, can also damage problem, infections. Another reason for the ulcer, it could be if you guys take medicine as an aspirin and ibuprofen, on an empty stomach, or if you eat very strong, very acid, very spicy food or on an empty stomach, that could create internal wall burning of the stomach, and this is called peptic ulcer. The tests are endoscope and X-ray. Okay, I think that was everything. We talked today about heartburn, stomach flu, and stomach ulcer. Thank you guys for being here. Please like, share, subscribe, write a comment, and let me know in the comment box below if there's anything you want to see related to languages and language services. And stay tuned, I'm publishing video every Wednesday and every Sunday. Please subscribe and press that bell button that can notify you every time I create a video. Thank you for being here and have a good day. Bye bye.